Today on 21st Century Television.
Explore state-of-the-art technology, innovative business strategies, insights from cutting-edge corporations around the globe. A visionary look into the answers of tomorrow, today. Business leaders, business solutions, 21st Century Television.
Welcome to 21st Century Health. I'm Jackie Bales. While millions of Americans are receiving treatment for ADHD, there continues to be a lack of understanding of the disorder. This is especially concerning for our high-risk youth, for whom ADHD is believed to be the cause of significant social and educational harm. Today we're joined by Dr. James Wiley, Chairman and founder of Focus MD, and Dr. Camille Washington, Executive Director of the Community Awareness Development Alliance, or CADA, to discuss this challenging topic. Welcome to both of you.
Thank you.
Thank you, Jackie.
Dr. Washington, tell us more about the problems that can arise if ADHD is not diagnosed and treated correctly.
Untreated ADHD kids have trouble paying attention in class and sitting still. So even though they're very bright, they can struggle with grades and also have trouble with impulsivity. This can lead to problems with saying things or doing things before they have a chance to think about it.
Dr. Wiley, tell us who Focus MD is and how you approach the diagnosis and treatment of ADHD.
Focus MD is a growing network of medical clinics that specialize in the diagnosis and treatment of ADHD and related disorders. We're very evidence-based. We want the scientific evidence base to be present in all the things that we do, from diagnosis into treatment and follow-up. And so that really manifests in us taking those guidelines and narrowing them down for each individual patient, because the guidelines have never met the patient. And so we have to really individualize our treatment for each patient, because there are no two that are just alike, though they share a lot in common.
Although the medical field has understood and acknowledged the very real existence of ADHD for decades, the concurrent problems of how to properly diagnose it, how to treat the patient, and how to assist their caregivers has been vexing and mostly ignored.
At Focus MD, we adhere to evidence-based treatment for ADHD. And usually, for most patients, that means medication management. Well, there are a lot of treatments out there for ADHD with varying degrees of evidence-base behind them, but none of them have the effect size of very carefully administered medication. So our clinicians work very closely with the patient to find just the right drug at just the right dose and find just the right delivery system of that medication to minimize the patient's side effects while maximizing the positive benefits of the medication.
The success that Focus MD has seen through their approach has caught the attention of others outside of the medical community. Focus MD and CADA have teamed up together to help high-risk youth within the juvenile justice system.
CADA is a nonprofit organization created by some of the doctors and the CEO of Focus to help underprivileged kids with ADHD who are not receiving the same level of care or testing treatment for their ADHD symptoms.
Dr. Wiley, we hear so many different statistics about the prevalence of ADHD. What's the truth? How common is this?
The truth is that ADHD is about 10% of the population has the neurogenetics of ADHD. And that number has been quoted as low as 3%, but most experts now would put that between 7 and 10%, and we believe closer to 10% of the population.
Interesting. Now, some say that ADHD is overdiagnosed. In fact, I've heard it said that, oh, they're just putting them on medication to keep them quiet in school. Is this your experience?
It's not. I do think that ADHD is overdiagnosed, and we know that sometimes, not at Focus MD, but we know that there are places where people are seeking performance enhancement. And again, this is another thing that gives people pause and makes them be overly cautious about coming in for diagnosis and treatment. And there are large segments of the population, especially that at-risk population that you mentioned early, that are having these behavioral problems spiral out of control, having academic problems spiral out of control, and no one realizes that that's the problem.
Interesting. So how often do you think it goes undiagnosed?
Quite frequently. And it varies, of course, as to, according to demographics, how much of it is undiagnosed versus diagnosed. It's just hard to know exactly how much is undiagnosed, but we know that 10% of the population is not on medication.
Wow.
One of the biggest challenges is a sense of hopelessness that a child develops over time, when faced with social failure, familial failure, failure in school. Prior to becoming circuit court judge and judge of the family court, I was an assistant district attorney, and one thing that I noticed just overwhelmingly was the number of high school dropouts that populated our prisons and our jails. I mean, just the vast majority of people, young people that I was sending to prison for life, they were 16, 18, 20, 30 years old, and all gotten in trouble early in their life, and that failure early led to a lifetime of really negative consequences.
I chose to come see Focus MD because I felt I needed to pay more attention in school, and I saw a lack of focus in my overall day-to-day life. Without Focus MD, I don't think I would have full tuition scholarships to college or have been given the opportunity to go to Girls State and Girls Nation representing Alabama.
I hate to think where we would be without Focus. It has just done so much for my son. There's just no words to describe where we would be. He has done every program that's been offered. We've seen such improvement in socially, academically, just in every aspect. Happy now, just a complete different child than we were when we first walked in the doors of Focus.
Working with Focus MD has been great for our family, and that it's enabled the boys to focus more on their school and get more out of it. Without Focus MD, would certainly had to have struggled a lot more with homework and life just around the house, and even all their social activities.
Thanks to both of you for educating us on the social and educational challenges presented by ADHD and the way you're treating it at Focus MD. Thank you so much.
Thank you, Jackie.
For 21st Century Health, I'm Jackie Bales. Thanks for watching.